angina pectoris. What is angina pectoris? We have seen that myocardial ischemia was occurring, but it is somewhere, it is leading to pain in the precordial area. That pain is called as what? Angina pectoris. So it can be not said that it is a disease. It is what? It is the symptoms which is getting visualized during the myocardial ischemia. So if angina pectoris is there, there is a different kind of pain that is occurring in the chest or the precordial area. So definition of angina pectoris is the chest pain resulting from myocardial ischemia. And what is myocardial ischemia? This is the inadequacy of blood supply to the myocardial tissues. And myocardium is due to ischemia, it is getting dead. Next is what? If the myocardium is getting dead, means the patient is not getting enough of blood supply to the tissues. Okay, so this is the reason the patient is suffering with the pain. Okay, so there is a demand and supply error. Demand is increasing and supply of oxygen is lacking. So due to this, myocardial tissues are getting dead. Okay. Etiology. We have to find out what are the reason, what is the risk factor which is leading to what? Leading to myocardial ischemia and lastly to the angina pectoris. Okay, so we had yesterday studied that coronary artery is supplying the blood to all the tissues, all the organs, but because of there is a blockage somewhere due to atherosclerosis or some kind of other thrombus or embolus which has circulated in the coronary artery, and it is leading to the blockage of that coronary artery. So this blockage will be lacking with the oxygen and their tissues will be lacking in the oxygen supply. So demands will increase. Coronary artery spasm is there, that may be the reason. Spasm may occur due to like stress conditions. We had seen that norepinephrine, epinephrine, parasympathetic, sympathetic activities which are also leading to the vasoconstrictions. And during winter season, there is a vasoconstriction, that is the systematic play that is being done by the blood vessels and they are contracting, and due to that higher spasm, the blockage of blood may occur. Next is coronary artery conditions, which is that will increase the myocardial oxygen demand, like physical exertion. One person is doing lot of exercise and exertional activity, or the laborer who is doing lot of work, and due to that his myocardial tissue will start working and pumping hard to supply blood to the organs which is demanding the nutrition, because once you will work very hard you will be hungry. So same thing is happening with the organs and tissues. They will require lot of exercise and lot of they will be exhausted and they will require the nutrition. So this is the reason which is leading to the myocardial oxygen demand. Next is emotion. What is emotions? Emotions are something again leading to vasoconstriction, sometimes stress, sometimes distress, or sometimes depression. These is leading to the vasoconstrictions. So especially when we are doing or we are in stress or we are examination fear. So in that time we will see that our peripheries or digitals are got cold. The lower extremities, upper extremities, like distal ends are getting cold. So due to that, again myocardial tissue demands will increase. Exposure to cold. Okay, especially winter seasons, the patient who are people who are living over the hill stations will experience these kind of problems. So all these things are somewhere affecting the coronary artery, and if coronary artery is getting affected, means there will be lack of efficient blood supply. If there is lack of efficient blood supply, means leading to what? It will lead to the lack of oxygen and lack of blood supply, lack of nutrition. The tissues will die because of starving of the oxygen. Stenosed coronary artery is another reason. I had told that coarctation of aorta means somewhere the arteries are getting twisted, okay, or it is being kinked, or somewhere it is being like constricted. So again the blood supply will be obstructed. Some kind of blood disorder. when we were studying about all these conditions, we have also seen that anemia is one of the leading cause, because if you are not having RBCs in your blood, then blood is not sufficient in your body, RBC is not sufficient, then in that case, what heart will pump? They will not have enough of fluid to pump. So they are not getting the venous return. In that case, the person will suffer with the, again, ischemic condition. Hypoxemia, again, there will be the lack of oxygen in the RBCs are there, which is attaching the oxygen, means because they are having HB molecules, hemoglobin molecules, which are attaching the oxygen with it. But already blood is low in the body, and patient is having low hemoglobin. So in that case, patient will suffer with lot of hypoxemic condition. Last one is polycythemia. Polycythemia means what? Lot of RBC in the blood, excessive RBCs. Okay, so you will just question that what is the reason if a question RBCs are increasing, that is good. But if something is not like sufficiently there, then also a problem. If something is in excessive, then also a problem. So your RBCs are increasing that much. If I'm telling you that in a class of 40 students, I'll make 100 students to sit, will you get enough of space to study? You will not be able to concentrate also. Forget about that. If we are keeping tomatoes in the refrigerator and they are excessively filled in the refrigerator, so in that case, what will happen? The healthy tomatoes will also get mashed and they will spoil. And due to this, what will happen? They will just spoil its naturality. Okay, so same thing is happening with the blood cells. Blood cells have excessively increased, and due to this excessive increase in the blood cells, the healthy cells will kill the other cells. Okay, so one next is what? Increased cardiac output. What is increased cardiac output? Means when the heart is pumping harder, when heart is struggling harder with the ejection of lot of blood in the body during exercise, during emotion, during digestion of large meals, hyperthyroidism. All these are the leading cause to increase the cardiac output, because organs demand will be increasing a lot, and they will make the heart work harder. So in that case, whatever the venous return is there, it will do excessive of more than the venous return. So in that case, ventricles will work harder to eject the enough of blood, because our body is requiring lot of energy, and that energy will be supplied by the blood or the nutrition from the blood. Next is digestion of large meal. I have explained you in the last classes. When we are taking large meal, we are consuming lot of food. During that, metabolic activities start, and due to that metabolic activities, you will strive for the more oxygen, more nutrition, more blood will be required. Next is increased myocardial need for oxygen, because damage to the myocardium will lead to more of need of oxygen. Myocardial hypertrophy, it has cellular growth is there, myocardial has thickened because of some reason or cardiac disorder. So in that case, again, it will require lot of oxygen. Then aortic stenosis is there. We had talked in last class that what is the aortic stenosis? Aorta is getting stenosed, means just getting constricted. Then in case if there is insufficiency of aortic, sometimes it is due to the valvular insufficiencies also. Valves are getting not flexible or not that elastic, or they will be not able to close on time. Sometimes because of that also it can lead to the backflow of blood chances may be there, or it can lead to the insufficiency of blood. In cases of thyrotoxicosis, what is this? Excessive thyroid hormone means thyroid stimulating hormone, which is again generating the energy generation is there, and these hormones are leading to the most of changes in the body. So this is because of thyrotoxicosis. If the hormones are increasing in the amount and it is lacking in the amount, then also it will lead to the thyrotoxicosis, and that will lead to myocardial infarction, and myocardial infarction will lead to the angina pectoris. All right. So we have seen about thyrotoxicosis. So in case if there is increase in the total blood volume and the decrease in systemic vascular resistance, These affects the increased preload and decrease the afterload and are accompanied by the increase in heart rate and myocardial contractility, and this will result in high output cardiac state. Then in case of strong emotions, again it will occur, heavy exertional activity we'll see. What is the pathophysiology of that? You can see that this is the endothelial of the inner blood vessels. What is the endothelium layer? That is a smooth muscle cell is covering it, and here it is the atherosclerotic plaque, that is the light yellowish or creamish color. You can see that the deposition is there. So due to this atherosclerotic plaque and thrombi, what will occur? Rigidity of these coronary vessels will develop. And if rigidity is occur, means it is getting stronger then and it's losing its elasticity, then means inability of coronary arteries to expand when heart is in need of more blood. So if there is no contraction, no relaxation, elasticity is not there, so coronary arteries will not give enough of sufficient blood supply to the heart because its demand has already increased, but supply is getting blocked somewhere. Then eventual development of collateral blood supply to the heart. So it will happen to what? It will just segregate into the collateral, two-sided blood supply, because it is just somewhere demanding the heart, heart is in demand to the blood. And if the oxygen and metabolic demands of the heart is still not met, then in that case, myocardial ischemia will develop. So definitely they are all striving to get the oxygen. Just take an example, if you are not getting enough of oxygen, you are not able to breathe. So in that case, what will happen? You will get exhausted. Till some time you will strive, you will struggle to breathe, you will take deep breaths. Okay, so you can get enough of oxygen supply. But in case if you are not able to meet that, ultimately you will get hypoxic and even brain death may occur. The same thing is occurring with the myocardial tissues. Oxygen has demand has so much increased because they are exhausted. Cells are getting exhausted, so metabolic demand is increasing. Next is it will lead to what? Diffuse pain and discomfort in the chest, and then it will radiate to jaw, shoulder, back, and arms. It will develop. So this is what angina pectoris has started. What are the clinical manifestations in that? So characteristic of angina we have to understand. So angina pectoris produces the transient paroxysmal. What is that paroxysmal? It is a sudden reoccurrence. It is not a timely, slowly it is triggering, but it is a sudden reoccurrence of the pain and attack of substernal or precordial pain with the following characteristics. So what is precordial? That is the front area of the chest. The pain has started occurring with the substernal. Oh, okay, on the sternal region, the patient is just grabbing over the chest and he is trying to hold to recover the pain. Next is onset. What is onset? When it is reoccurring, when it is occurring. Okay, so it can develop quickly or it might be also slowly. Some clients ignore the chest pain. So I said in previous classes that some clients are that they might feel that it is an indigestion pain. So they might have been suffering with the food indigestion, or they might feel that it is an indigestional pain. So they try to avoid it, and it will lead to what? It can be misled to the angina. Okay, and then location. What are the places where the pain is occurring? Nearly 90% of client experience pain at the retrosternal, means breast, behind the breastbone, or the organs which are at the backside of the breastbone. So what we can say is the pain is occurring in the backside of the chest region or the retrosternal region, backside of the sternal region. So this is what related to the breast, breastbone, which is having the organs behind, and there the pain is initiating. Radiation, where it will radiate to the left shoulder, where the heart is slightly slanted, that is at the left side. Therefore, the pain will start with the left shoulder, and then it will go to the upper arm, and then it will travel down the inner aspect of the left arm to the elbow, then to the wrist, and then fourth and fifth finger. Okay, so this will radiate in this way. So upside to the downways, it will radiate. The pain may also radiate to the right side shoulder, neck, jaw, or epigastric region. So all these are being, so it is radiating towards the all the circulations. Next is duration, how much time it is occurring. Angina usually lasts for less than 5 minutes. However, attacks precipitated by a heavy meal or extreme anger may last up to 15 to 20 minutes. So usually we see in lots of movies and all that patient suddenly after some shock or some kind of stress or some kind of anger may go to the like have the chest pain and they get heart attack and all. So this is what the duration of pain. If the patient might suddenly suffer with the anginal pain, it may be lesser than 5 minutes. But if it is due to some of the cause that is increasing or leading or triggering the activity of pain, then in that case, it may also last to 20 minutes also. Sensation, what kind of feeling it might have? So sensations may be in clients describe the pain of angina as squeezing, burning, pressing, choking, aching, or feels like gas, heartburn, or indigestion. Clients do not describe angina pain as a sharp or knife-like pain. They won't say that someone has hurted me with the knife. It is not like a pinpointing pain, but it is like a throbbing pain. Someone is squeezing, like we squeeze the cloth. If something is burning, we are having an acidity pain. So he will say that. And some will say that someone is pressing my chest very hardly. Okay. Or something has choked, something has blocked. So all these things will lead to the sensational of the client. So the pain sensation is very different. Severity of pain will depend on mild, moderate, and in severity. It's also said as discomfort, not pain. The patient may not have a particular type of pain, but he is having a feeling of discomfort. He is not in comfortable situation and he will be restless. Rarely the pain is described as severe. What are the characteristics associated with it? Dyspnea. The patient will have a breathing difficulty. Patient will be paler because blood supply somewhere is stopped. Sweating, diaphoresis will occur. Faintness, patient will be giddy and patient may faint. Palpitations will occur because exhaustion and the cardiac ventricles will be exhausting and palpitating fast to supply the blood. Dizziness, he will be a bit dizzy and digestive disturbance will be there. Relieving and aggregative factors are angina is aggravated by constant of activity. If you are still doing some exhaustional activities, then it will trigger. And it is almost subside with the administration of nitroglycerin because it's a vasodilator, and with the rest it can like subside. The typical exertional pain is rest release and pattern is major clue to the diagnosis of angina pectoris. So it may be relieved with the rest, but in some cases it is not. Okay. So next is what classic angina. That will be subdivided into following basic patterns. What are the patterns of angina? So first is we'll just see classic angina pectoris, which is again subdivided. Stable, unstable, variant, nocturnal, angina decubitus, interactable, and then lastly post infarction. So just see, stable means what? If you are resting and it is getting stabilized, that is a stable. Unstable, it is like even though with the rest, it is not stabilizing and it can be dangerous. So let's see one by one. Unstable angina, but is the we have seen paroxysmal like chest pain. It is a sudden reoccurrence of pain, and discomfort will increase with the predictable degree of exertion. So if he is walking 50 feet also or emotion is developing, he might like trigger with the pain. And it will be stable pattern of onset, duration, severity, relieving factors, all those which we studied above, like it will be stable pattern. So it is not deviating from it, but normally this will be relieved with the rest or nitroglycerin. But in unstable, it is just opposite. It will be triggered by any kind of unpredictable like degree of exertion. Even though if you are not exerting, any exertion is not there, then also it can occur. Even sometimes during night you are in rest, it will occur. So this is a kind of medical emergency and clients should receive the medical treatment. In variant angina, it is also called as Prinzmental's angina. In this, what will occur? Chest discomfort similar to the classic angina, but it will be for the longer duration. It may occur while the client is in rest, and attacks tends to happen between midnight and 8 a.m. So when you are in quite good sleep, and that time it may occur. Variant angina results from the coronary artery spasm, not due to the blockage, but it is due to the spasm. And even with the ST elevation, which we had graphically seen during myocardial infarction, if oxygen supply is not there, then in that case, ST elevation will be there in the electrocardiogram. Nocturnal is a thing which is leading to the rapid eye movement and possibility associated with the rapid eye movement and REM. It is called as REM. Sleep during dreaming. During the night time, if the patient is dreaming, that time he will see the nocturnal angina. Then angina decubitus. It is again the paroxysmal chest pain that occurs when client sits or stands up. During lighter activities also it is occurring. Interactable. It is a chronic incapacitating angina that is unresponsive to the intervention also. If even though if we are giving any kind of treatment, there will be no worthy like relevance of that. Then in post-infarction angina, pain occurs after MI when residual ischemia may cause episodes of angina. So it is lastly after myocardial infarction, it is leading to the ischemic condition and episode of angina will occur. So we are aware about the diagnostic test, electrocardiography we will do, stress test we will do like treadmill test we have already explained in the previous classes. Radioisotope imaging, that angiography can be done. Then even graphical representation can show that where is the spasm, where is the contraction, where is the blockage. Chest X-ray will also see the any kind of size increase or anatomical structural damage that can be shown. What can be the management? We have to manage the therapy for chronic stable angina are to reduce the manifestation. The symptoms have to be suppressed. So whatever things we are doing, we is ultimately reducing the risk of mortality and disease events. So what we will do? A, B, C, D, E we are keeping in mind. So in previous classes we had seen the algorithm of Mona, but here we will see A, B, C, D, E. A is for aspirin and anti-anginal therapy we will give. B is beta blocker therapy. Again, it will suppress the sympathetic activities and blood pressure control will be there. C is cigarettes or the cholesterol should be seized or the factors which is triggering has to be controlled. D is for diabetic and diet has to be controlled. Lastly, education and exercise. What are the goals of treatment? We have to relieve the acute pain, restore the coronary blood flow, and prevent the further attacks to reduce the risk of acute myocardial infarction. Opiates means morphine was one of the painkiller we were to give to release the sudden pain. Vasodilators will keep the patency of the blood vessel, so that will be widen the diameter. So coronary arteries will release appropriate amount of blood and oxygen to the myocardial tissues. Then nitroglycerin, again vasodilator nitrates will help the coronary arteries to vasodilate, thereby promoting what? Greater blood flow and oxygen supply. Beta adrenergics will help to reduce the workload of the heart. Okay, if the myocardials are contracting highly, so they will have a lot of oxygen demand. So they will decrease the workload. If workload is decreased, that means myocardial oxygen demand will also decrease. And lastly, anginal attacks will also decrease. Next is calcium channel blockers. Again, it is used to dilate the coronary arteries and increasing the myocardial oxygen supply. Antiplatelets, what it is inhibiting? It is stopping the platelet aggregation and it will reduce the coagulability. Means the platelets which are aggravating the clotting factors, so that will prevent the clot formation. Nursing diagnosis will be ineffective cardiac tissue perfusion. So we have to increase the tissue perfusion, means blood supply has to be increased. Secondary to what? Coronary arterial disease with the evidence of chest pain and equivalent symptoms. And then lastly, anxiety related to the outcomes of the management and death. So deficient knowledge about underlying disease and methods for avoiding the complication, and non-compliance, ineffective management of therapeutic regimen related to failure to accept the necessary lifestyle changes. So in case if the patient is not even going through the or not able to accept the therapeutic also, means treatment also is not effective. So in that case, even lifestyle changes are not working. So in that case, the patient has to be like managed quite well. So this is what about the angina pectoris. So I hope this is clear with